in this capital plan. We are dedicating nearly $30 billion over the next 5 years, meeting the healthcare needs not only of Edmontonians, certainly of Edmontonians, but also Albertans from across the northern parts of the province who come here for specialized care. And while this funding is most certainly about having appropriate facilities and capacity, it's also about the importance of maintaining what we have. It's about the importance of maintenance upgrades to meet Albertans' emergency needs, inpatient emergency needs, outpatient health needs. They are extremely important in terms of maintaining the asset base that we have, and they are important for the comfort and safety of the patients who are in facilities such as this.
The deferred maintenance, accrued deferred maintenance, as of this day in Alberta is over $1 billion. And this government just tried to spin a good news announcement out of the decision to add an extra $30 or $40 million a year to deferred maintenance. But it is, in short, a drop in the bucket. And it's a drop in the bucket because this government has squandered our resources in the good times and left us struggling in the bad.
Of these projects, we'll be redeveloping the redevelopment of Royal Alexandra Hospital. The main tower needs to be replaced. It's out of date. Design has fallen behind the standards for high-intensity acute care. Rooms don't allow access for the kinds of equipment we have today. Capital plan also includes dollars for Misericordia Community Hospital. We've started work on a thorough assessment of the current facility, look at potential rehabilitate it. As we announced a couple of weeks ago, we will renovate the emergency rooms at Misericordia and Grey Nuns. Work is also continuing on upgrades, emergency at Royal Alex, and which were previously funded, providing $76 million over the next 5 years, ongoing projects to the Stollery Children's Hospital. And finally, we'll proceed with a business case for the Brain Center at the University of Alberta Hospital.
In terms of the capital announcements, as far as we can tell, AHS has a list of about 7 or 8 priority capital announcements or capital projects that must be done right away, and we're happy to provide you with a copy of the list. Today we heard about one of those, just one, and that list was made in November of 2014. So we're clearly not meeting our needs.